Thank you, Rabbi Lawrence. Okay, today we are going to look at a question which was asked actually from Hendon to Rabbi Weiss in Jerusalem. It's an old question, but it was asked with an eye to whether perhaps the situation had changed, or the context had changed, and therefore the facts had changed as to how this question would be answered today, as to how it was answered in previous generations. And it was written, the answer was written on the 4th of Nisan, so 11 days before last Pesach, to give the context of the question. And the question was asked by Dr. Elisha Kahan, who lives in Hendon and is a student at Rabbi Weiss, and organized the last times that Rabbi Weiss came actually to speak in Kinloss. So the question which Dr. Kahan asked is unfortunately not an unfamiliar one. He says that since, particularly at that time, you remember back to those times in April this year, there were many hospitals in London that, because of the fear of the spread of the coronavirus and the high possibility of infection, would not allow anybody who was hospitalized to bring anything out of the hospital with them if it was impossible to clean it properly or to sanitize it properly. Of course, these were sadly questions in practice that we've had to deal with at that time. And he says, and in particular included in this, it wasn't possible to allow for Tefillin to be brought into certain wards in the hospitals at the time when various patients were ill, because the hospitals were not allowing the Tefillin to go out without proper cleaning and sanitation. There was a concern, and of course this concern was based on the fact that everyone was trying to scramble to figure out what was going on. It wasn't that there was plenty of time to sit down and analyze all this carefully on all sides. There was a concern that cleaning the tefillin in the required way, I'm sure the doctors who are watching would know much more about this than me. Certainly from what I heard at the time, cleaning the tefillin in the required way would very likely damage the tefillin in a way which meant that they would be pasul, and obviously wasn't practicing towards them in a respectful way. So the question that Dr. Khan asked was, particularly given that a patient is unable easily in every case to choose which hospital that they're going to go into, you just go to whichever hospital has availability, and sometimes a patient will be hospitalized in a ward and they don't know necessarily what is going on or why they've been put there, and they don't know what the circumstances are. So Dr. Khan says the very sad question he wants to ask is it permissible to bring tefillin into the hospital when we know that it's possible that when, please God, the patient recovers, they will need to leave the tefillin in the hospital and the tefillin would be destroyed as part of the safety procedures in the hospital? Or is it better to apply the rule of shave the al ta'aseh, which means you just, rather than saying that we're getting rid of a mitzvah, we just don't do the mitzvah. It's a bit like not blowing the shofar on the first day of Rosh Hashanah on Shabbat, or not taking the Arba Minim on the first day of Sukkot on Shabbat. So it's shave the al ta'aseh. It's still a mitzvah, but we're just sitting and we're not doing it. Is that better to sit, so to speak, and not do the mitzvah? Or should one take the tefillin into hospital in such a situation, even if there is a possibility that Rahman al-Islam they would be damaged or destroyed? So that's the question that Dr. Kahan asked. Tomorrow we will begin to see how Rabbi Weiss approaches this based on many precedents, as he will describe. Take care. Have a great day.
You too.
Yeah, thank you, Rabbi Laitner.